Let's talk about the 3 phases of therapy because you're going to need to know them for your PsycNP board exam. First up is the orientation phase. In this phase, you're going to establish rapport, you're going to set goals, as well as get informed consent. Next up is the working phase. This is where the magic happens. You're going to identify problems and develop coping strategies. This is also where transference and countertransference can occur. You need to know that about this phase. And finally, we have the termination phase. This is when you're going to be ending the therapy. You want to make sure that you are reviewing the progress that the patient has made, as well as preventing relapse, so education to prevent relapse. And then finally, you want to address the patient's emotions about ending the therapy. Some of the challenges that you need to know when it comes to psychotherapy is that there may be some resistance, that the patient may not be wanting to open up during the beginning of the therapy. There may also be some level of crossing the limits that you've established. Like once you've set boundaries, they might want to cross them, push your buttons. There can also be transference and countertransference. I'll talk about that in another video. And then during the termination phase, there may be some regression of the symptoms or client dependency on the psychotherapist. Overall, I guarantee you will have at least one question about the phases of therapy on your PsycNP board exam. So if you do want to pass it on the very first time, drop me a follow because I'm creating content like this for students just like you. Also, check out the link in my bio because I've created this ultimate study guide that has everything that I just talked about right here under psychotherapy and the phases of therapy, as well as a bunch of other therapy knowledge that you need to know, and 300 other high-yield topics that will show up on your board exam. Check it out if you have the time, and let's get you board ready.